Dr. Phil Frank Mandera, giving you another discussion on Christmas Eve about drugs and what we need to know about them. Now, when I say drugs, I mean prescription drugs that are commonly prescribed to us. Lately, and often, you'll see I'll see patients that have a long medication list. You may have a friend or family member that has a long medication list. And with each drug you take, there are side effects to that drug. So if you take 2 drugs, 3 drugs, 4 drugs, 10 drugs, they all have side effects. And what we need to think about and understand are the interactions between those drugs, because they don't act independently of each other. They may act together to do something to the body that may be unintended or unintentional. So what I did, I just found a random patient that we had on file and just looked at their drugs and see if there's any interactions between them. So I'm just going to read through that list now, and I'm going to give a brief description of what it is. I'm not going to dive into the pharmaceutical details of the mechanism of how the drug works. That's not what this is for. This is just a quick, easy application of understanding how drugs can interact with each other and why it matters. So if we look at this list here, we have Eliquis, that's an anticoagulant. Linzess, that's for irritable bowel syndrome. Latanoprost, that's for glaucoma. Furosemide, diuretic. Lipitor, that's for high cholesterol. Omeprazole, I think I said that right. That is for gastroesophageal reflux disease. Ranitidine, that's an antacid. Levothyroxine, that's for hypothyroidism. Valsartan, high blood pressure. Lisinopril, that's an ACE inhibitor, that's for high blood pressure. Amlodipine, that's a calcium channel blocker, that is also for high blood pressure. Metoprolol, that's a beta blocker, that's also for high blood pressure. And oxycodone, that's for pain relief. So when I see a long list like that, and I see a patient that has high blood pressure, I'm automatically going to check their vitals, especially blood pressure, pulse rate, and then I'm going to look to see if there's anything weird that happens when I treat them. So if they're coming in for a shoulder, let's say, and they have these drugs and they're taking oxycodone for pain relief and they have all these other meds listed here, you kind of have an idea of what to expect. But if there's ever something weird that happens, I may refer back to this medication list and see if there's any interactions. Now, do I know what those interactions are on the top of my head? Of course not. But there's a website that I like to use. It's drugs.com, easy enough. And I can type in these medications and see if anything happens. So I went ahead and did that. And let's see if there's any kind of interactions that may happen. And right on the top list, we see here an interaction between furosemide and metoprolol. So this can cause dizziness. You may also feel like you have fainting or you're going to pass out. So if that was going on, I may look at that and have them go to their doctor to get the medications adjusted. Another interaction we see here is levothyroxine and Linzess. That could be, those interactions could cause diarrhea, some irritable bowel symptoms. So if you had come to me and said you had those types of symptoms, that's really not something I'm expecting. And again, I may have you refer to your general practitioner. Oxycodone and valsartan, that could be side effects of those interactions of headache, dizziness, lightheadedness, fainting. So if you have been coming in and all of a sudden you're having dizziness, lightheadedness, obviously we would stop the exercise, talk about what's going on. And again, I would see that interaction with those 2 meds and have you go to your general practitioner. Maybe a drug gets eliminated, maybe the dosage gets adjusted. What else do we have here? Omeprazole and Lipitor, together combining these medications may cause an increase in blood pressure. If I was checking your vitals and I saw that your blood pressure was abnormally high for no reason, again, I would have you go to the doctor. And I could go on and on and on, but what the general theme is that really be aware of the medications that you're taking, even if they are prescribed by a doctor. There may be medications that he's not aware that you're taking, he or she is not aware that you're taking, and they may prescribe something different to you. When you come in to a physical therapist or any healthcare provider, you fill out a lot of paperwork. And you may be thinking to yourself, why am I filling out all this paperwork? Well, this is one of the reasons why. So we know and are aware of the medications that you're taking, so we can really be safe and prevent anything that could happen. I'd hate to have you pass out on the street or at home if nobody's home with you. I'd hate to have any kind of interactions that may or may not be necessary. There's been a couple of times where I've had patients that have had super high blood pressure that came out of nowhere, was not expected. And I looked and I saw that there's an interaction with 2 medications. I don't remember what they were. And I said, it looks like you may have an interaction with these meds. Go to your doctor and have it checked out. This patient had their medications adjusted and it was never an issue again. So it's really all about reducing risk factors for other things that can occur. Another big thing that stands out, I had a patient that was taking a bunch of medications, and on top of that she was taking a medication called amitriptyline. It's for severe nerve pain. And one of the side effects of that drug were hallucinations and depression, suicidal thoughts. And she was actually having that. And I had instructed her to stop taking it right now and go talk to her doctor. And again, she went, talked to her doctor, had her dosage adjusted, and it was never an issue again. And thank God we had that sort of issue averted. So hopefully this kind of opens your eyes. Again, if you have a parent, a grandparent that has this laundry list of medications, go ahead and type them into some kind of drug interaction checker. Like I said, drugs.com is one. I know WebMD is another one that you can go on to. It's very simple to use. Just look at the name of the drug, type it in, and really give yourself an idea. And if you find that your relative, your friend, is talking about having certain weird symptoms that is out of the ordinary, instruct them to go see their doctor. And that's what I, as a physical therapist, a healthcare practitioner, will do. So hopefully this was instructional for you. Just giving you another thing that physical therapists can provide. And I hope you learned something from it. Again, I'm Dr. Phil Frank Bandera from Total Performance Physical Therapy. Merry Christmas, everybody. Enjoy your holiday season.